Hi everyone, I'm Dr. Durgaprasad Reddy, Head and Professor, Vydehi Institute of Cardiac Sciences, Vydehi Hospital, Whitefield, Bangalore. Healthy heart to check at home, there's a lot of mechanism has come now. Simple mechanism who doesn't have any gadgets or watches can read out your heart rate. The ultimate thing is you have to maintain the heart rate around 70. That gives a very healthy heart because once the heart rate is very low, then your coronary perfusion is very good. If you keep your increasing your heart rate by having anxiety or keeping the heart rate above 100, that means your coronary perfusion is going to be less because always the coronary blood supply is in diastole. So you have to improve your diastole interval by keeping your heart rate low. This is the first and basics things which everyone should follow. For that to happen, you have to do cardiovascular exercises like don't use your lifts, use your staircases. That itself is a testing. You start walking around 3 flights of stairs and you start become breathless. Everyone becomes breathless, but that recovery time should be quick. Once the recovery time is quick, that means you're free. If your recovery time is not quick, you're still gasping, that means you need to check. And so many things, like you can also have watches are available where it can measure your BP and heart rate. That can be done, and that is how you monitor. And make sure when you wake up in the morning, you don't have any palpitation, you don't have chest pain, you don't have dizzy feeling. All these things are preventable, and this is how we monitor as a layman person at home.